What I thought we would do is maybe I'll introduce just a little bit about the Lean Lab course, and then we'll jump right into the presentations. And I think then the presentations are 12 minutes each. The teams know that they have to convince you that their business model is sustainable and scalable and practical, and they've been practicing all semester. And just a little bit of background on the course. When we started in September, really very few people in the class knew one another. We put the teams together at random. It was a little random number deal, and everybody here got thrown into a team that way. And in fact, very, very few of the students, I don't know if any of you want to even say who you are, well, very few had any background working in startups or even with business models. So it was a very new experience, right? Would you agree for most of you? To be involved in something like this. They had public health training because they did take their basic public health courses, but nothing with trying to make it sustainable in a market approach. So the way we run the course is using a Lean Launchpad approach with a business model canvas, and the key to that is that the teams have to interview a lot of people. So they've all interviewed at least 100 stakeholders, sometimes more, sometimes 150, right, or more. And they've done that every week, every weekend, every evening. They've gone out and talked to people about their business model. And very importantly, they've taken that feedback back into their model so that they've been able to change and to pivot according to the changes that we recommend. They work very, very hard. It's a really wonderful group of young people. And there are 6 teams with business models that range from trying to prevent maternal mortality to improve the nutrition for college students, to helping to prevent campus sexual assault, which seems to be pretty timely at the moment. A little bit about the space. The Lean Lab is, I think, 3.5 years old. Is that right? 4 years old?
You're correct.
3.5.
That was it. Okay.
Is really a hub at NYU, which brings together resources from across the university. So we have faculty from the arts and sciences, from the business school, from the engineering school. Really under the great leadership and guidance of Andy Moss and Rebecca and Frank Romalowski here. And what's great about this place we were talking about earlier is that we share a common way of teaching entrepreneurship, and so we can exchange a lot of different ideas and programs. So if you were to take this class in Stern, it would look a lot like the class you took here. So I'm not going to go too much further. I'm going to make sure that I introduce Faith Wallace-Gadsden. The two of us did this course together. All semester long. Faith is just an amazing educator. If you want to say anything at the end, she'll probably say a few words, but we've had quite a lot of fun. And Anthony, who's been our course assistant through the whole semester. So I think I'm just going to leave it there and let the team start to present. Are you ready? Okay, you're on your way.
Good afternoon, everyone. My name is Tiffany, and today my team, Shezel, Hunter, Barry, Megan, and I, will be talking about our business, Medico Consulting. Now, before I go into our presentation, just to give you a little overview of what we're going to be talking about today, Shezel will start us off by telling us some of the public health issues we currently see in the market. Hunter is going to talk about our business. I'm going to be talking about some of the financials of our business. Megan is going to go into some of the benefits of our business, and then Barry's going to end by telling us about how we're going to achieve all of this. So I'll now pass it on to Shezel to talk a little bit more about some of the public health issues we currently see in the space.
So by the time that the ambulance got to her, Julia Rusnick was already dead. The Yale University senior went into cardiac arrest and collapsed on the street, and all she needed to live was zapped to the chest from a defibrillator within 6 minutes of her falling to the ground. But unfortunately for Julia, it took the ambulance 12 minutes to get to her. A college-based emergency medical service, or an EMS program, allows for an entire community of students to receive immediate access to emergency care. If a student-led EMS program had been on campus, a certified and equipped student would have reached Julia in 2.6 minutes and saved her life. The average amount of time that it takes for an ambulance to reach the patient in New York City alone is 9 minutes and 42 seconds, which is far too long in life-threatening emergencies. And although not all issues on college campuses are life-threatening, it is still vital that the student receives immediate attention. So some of the programs that are found on, some of the problems found on emergency, on campuses are alcohol overdoses, infections, which results in major or minor wounds, and occasionally drug overdoses and suicide attempts. So it is imperative that a student receives immediate attention because every second counts, no matter what the doing is. And I will now pass it on to Hunter, who will tell you what our business is about.
Thank you, Cheryl. So, Medico, our business is a consulting agency that facilitates in the development and implementation of student-led emergency medical service programs at colleges and universities without one. These student-led emergency medical service programs are just like all the other emergency medical service programs, but the emergency medical technicians are students of the school. These students will undergo training to become nationally certified emergency medical technicians at our partnering training facilities and organizations. As a part of our consulting service, we offer an institutional assessment report and various advisory services. Our institutional assessment report provides a summary of our client's institute's unique situation, whereas our various advisory services aim to help our clients make the appropriate decisions for the development of their EMS program. So, as a business, we're looking at a market where there are 2,915 four-year institutes in the United States, but only 230 of these institutes have their own emergency medical service program. This means that over 90% of the institutes in the United States of America don't have a system to respond to the medical emergencies in their own community. As a business, this is a huge opportunity as we are a low-cost business, and this is a largely untapped market. As far as we know, there are no other agencies out there like ours that focuses on the development of EMS programs at colleges and universities. Now, Tiffany will talk about our potential customers and more.
Thanks, Hunter. So we interviewed around 100 schools, and we found that majority of the schools that didn't have EMS services already were interested in a product like ours. The only barrier is the lack of knowledge and guidance that they have, so that's where we come in. On top of that, as we build credibility and gain trust, we have the ability to go into some of the EMS programs that are struggling, so we have a market beyond just 90%. As you can see, our revenue model is very simple. We think that we will have about 2 streams of revenue, and one will come from the one-time fee we will charge schools, and the other is going to come from the profit sharing we get from local EMS training facilities that we partner with. As you can see, in terms of sustainability, we don't foresee many costs associated with starting our business other than employment costs and overhead costs. And because we plan on starting this at NYU, our costs will be even lower. In 1 year, we think that within our first project, we will become profitable. I'll now pass it on to Megan to talk a little bit more about the details of our business.
So from these activities, Medical Consulting Service will provide consulting service to universities and students at their corresponding campuses to establish an EMT program. This will enable the students to make a positive impact on the overall well-being and the surrounding areas. So based on these programs, the following benefits each of the universities will have. More students will be willing to contact these EMTs and report emergency problems that they may have, unlike other non-collegiate EMTs. They'll be more comfortable calling on them just because it's more of a peer support, and they will establish a peer-to-peer support system throughout the entire campus. Based on the interviews that we conducted with students at universities with EMS programs already established, a lot of them had mentioned that the student EMTs were overall had a positive perception of them and were very willing to reach out to them and call them in their time of need. Based on this, it will decrease the overall incidences that occur on campuses, which will overall reduce the costs for the universities themselves. This will provide a sense of well-being and a peace of mind for the students, university administration, and even the parents of the students that attend them. So by providing a tailored EMT program for these universities, they will be able to offer a better EMT service overall, as well as establish lasting solutions. As you can see from the three numbers, the overall response time will be cut down to approximately half. They will reduce the amount of unnecessary hospital visits by not using ambulances, as well as reduce the cost for the universities themselves about 50%. And these EMT services don't necessarily have to be emergency. They can also be used as part of the campus-wide activities such as sporting events and other student-led initiatives. As to how we were going to be doing this, Barry will now discuss this further.
Thank you, Megan. We will be reaching out to colleges and universities with no existing EMS service to help provide and ensure a safer campus environment. We will be acquiring our customers through the Campus Safety Magazine and as well as at their conference. We will be also actively reaching out to universities, university administrators, and their campus safety department, as well as broadcasting our service through a wide range of national and local EMT training programs. In hopes of putting students first, we will need a partner with local training EMT training facilities to help provide initial training for would-be first responders, as well as provide any additional supplementary training. We also need the support of various levels of government agencies, be it FEMA, each state's Department of Transportation, as well as any other local medical facility out there. In order to successfully capitalize on this market, we will need to have a clear and knowledgeable understanding of the various conditions and factors that drive a successful EMS service. With the advice of industry experts, we will have the knowledge of specific state certifications needed to lawfully operate an EMS service, as well as the knowledge of various organizational models to ensure a smooth operation of each service. As we grow and continue to provide our service, we will gain the experience necessary to quickly implement our service in a multitude of settings. This industry has been stagnant for far too long, yet it is so important. We need to start putting the health and needs of students first to ensure a brighter future for everyone. Thank you.
Hi, I'm Katia.
Hi, I'm May.
I'm Jamie.
I'm Amber.
And I'm Laura.
And we are MOM, Mothers Instructing Maternal Mortality, and our goal is to give autonomy back to the patient of care.
Okay. So the clicker isn't working. I will be standing over here. Yeah, the slides are changing over here on the screen on the computer, but not up there.
I think you should hit allow at the top. It says that it's saying if you're in full screen.
Thank you. Here you go.
Okay, so this is Lauren Bluestein. She had her husband by her side while she was giving birth. After 90 minutes, she experienced preeclampsia. Preeclampsia is hypertension superimposed on pregnancy. But she kept experiencing this pain, and the doctor insisted that it was acid reflux. The reality was that, again, it was preeclampsia. She was given anti-acid pills and painkillers, but they kept failing. Her blood pressure was increasing at 160/95, while the recommended advisory is that 140/90 indicates preeclampsia. Although her husband kept asking for tests, his requests kept falling on deaf ears, and the tests were coming back non-conclusive. 20 hours later, Lauren was dead. If only Lauren and her husband had proper resources to confirm the direct proof that she had preeclampsia, then the doctor could not have denied their truth. This is not just the story of Lauren, but the story of thousands of women who have died and experienced maternal mortality during their postpartum period. Alternatively, Mary McCausland had a dismissive doctor as well, and she read Lauren's story and realized that she had the same symptoms. Luckily, she read that story and she survived. Therefore, we here at Mom want to continue success stories like Mary's by providing them with our app, Mom, that includes a questionnaire created by the Association of Women's Health, Obstetric, and Neonatal Nurses, which is designed to flag symptoms of major causes of maternal mortality and thus preventing stories like Lauren's.
And so we bring to you Mom, an app consisting of a simple questionnaire, again, catered to flag the symptoms of the major causes of maternal mortality. So our value proposition is we hope to prevent cases of maternal death by providing information in a clear and concise manner and by returning autonomy to the receiver of care. Further, we seek to restore peace of mind to the patient and for pregnant women, new mothers, and their loved ones by eliminating the ongoing arduous process of searching the information for reliable information regarding their health. And lastly, we hope to empower women with the resources they need to take an active role in the quality of care that they receive.
Okay, so as I said before, maternal mortality is a really big problem. It's actually a worldwide problem, with the highest rates occurring in low resource settings. The United States, though, which is a developed country, is actually amongst the ranks of some undeveloped ones.
So annually, 700 to 900 women experience maternal mortality, while 65,000 experience maternal morbidity. This is the worst record in the developed world. As you can see by this graph, the US has experienced a drastic increase from 2000 to 2015, while the rest of the developed nations are decreasing. 80% of these deaths are actually found to be preventable in the US.
Here you can see the top 4 medical causes of maternal mortality, which includes embolism, hemorrhage, preeclampsia, and eclampsia, as well as infection. So in this graph, it shows that maternal mortality occurs mostly within 42 days of childbirth, which is considered the postpartum phase. A lot also occurs during pregnancy, and then less so after postpartum phase. This is why we have created a timeline to show this vulnerable phase, this period of time. We can see here that embolism, preeclampsia, and eclampsia can span from 20 plus weeks pregnant all the way until 6 weeks after childbirth. Hemorrhage can occur during the postpartum phase, and then infection can last a little bit longer, all the way until 8 weeks after childbirth, mostly because it's caused by C-sections, which is considered as a major surgery.
Not only does maternal mortality show distinction in when it's most likely to affect mothers, but it also shows distinction in which mothers it's most likely to affect. So the chances of experiencing maternal mortality is not shared equally by all mothers. 3 groups are most susceptible, and these 3 groups are low-income groups, racial ethnic minority groups, and individuals living in rural areas. So why is the rate of maternal mortality in the U.S. rising? Why is the rate of maternal mortality in the U.S. so high when compared to that of other nations? And why does it show discrepancies in when it's most likely to affect mothers and which mothers it's most likely to affect? So there are an array of factors that can be attributed to these causes, or to this, and we've categorized these factors into 3 distinct categories: discrimination, poverty, and systemic failures. Addressing any one of these 3 causes will lead to a lessening of the incidence of maternal mortality. However, for the purposes of Mom, we wanted to address the issue of systemic failures, considering the fact that maternal mortality usually occurs during the postpartum period, which is usually after mothers had a trip to the hospital. So the particular systemic failure that we want to address is that the lack of information and autonomy that is given to the mother from her healthcare provider. This disregard can be accredited to unconscious or conscious discrimination on the part of the healthcare provider, or it can be attributed to the fact that the information and advice and warnings that come from the healthcare provider typically pertains to the baby rather than the mother. So thus with Mom, we plan on compensating for this shortcoming by creating an app which will provide this missing information to the mother.
And so this is a general breakdown of the layout of our app, Mom. So the user would log in and complete a preliminary profile. You can see including whether they're the expecting mother or the partner and family member, their preferred language, the medical contact information of their medical care provider, as well as the expected due date. for their pregnancy. And then we have the medical contact information included for the click-to-call feature. So depending on the severity of the user's responses, the mother or loved one can instantly call their doctor, or if severe enough, call 911 to seek medical assistance. We also request due date information to send out a reminder to visit their physician during or OBGYN in the postpartum phase, considering most maternal deaths occur in this period. And so this video here will show you the how our simple questionnaire works, and then at the end it will deduce different levels of urgency based on the responses. As Amber said, either click to call your doctor or 911 if severe enough. And then there's no liability because we're not concluding a diagnosis. Rather, we're referring them back to their personal physician. And the symptoms are based on a certified checklist from the Association of Women's Health, Obstetric, and Neonatal Nurses. Okay, so our total addressable market is all women who are pregnant in the United States, as well as their partner and family. So there are 239,000 pregnancies annually in New York City, and 4 million pregnancies annually in the United States. And so this is the ceiling for the customers we could reach with our app, that being women who are 20 plus weeks pregnant with the inclusion of their partners or family members. So further, we will acquire and maintain customers through the following channels: through clinic and hospital referrals, social media channels such as Pinterest, Instagram, and Facebook, main ones moms love to use, their data mining mechanisms will allow us to reach our target population as efficiently and effectively as possible. Lastly, we will flyer and paper clinics such as Planned Parenthoods to provide discounted versions and subscriptions to particularly vulnerable communities.
So for our revenue model, we decided on a subscription-based app. So within this model, our customers will be given a 1-week free trial. They can test the app and see how they like it. From there, they would pay a $5 monthly subscription. And for those individuals who demonstrate financial accessibility issues, they'd be required to pay a $2 monthly subscription. And these prices are based off of our 100+ interviews.
So this is our business model of sustainability, which is essentially based upon the idea that we can reach around 20% of our target population. So our annual costs included things such as social media marketing, maintenance fees, development team costs, revenue that the App Store essentially takes from us for having an app within their store, discount costs as well as flyers. And so our projected conservative estimate for 1 year comes down to around $7.6 million. And theoretically, if this were a perfect business model where we were able to reach 100% of our target population, our revenue for 1 year could come down to around $85 million. So we here at MOM are confident that our venture can act as the first push and a ripple effect towards a nation with a decreasing rate of maternal mortality. Thank you.
Okay, that's on. Thanks for it off. I think that's right.
Hi everyone, I'm Alicia.
I'm Raul.
I'm Lucia.
I'm Irene.
I'm Lucianne.
I'm Roshana, and we are UVIA. UVIA is a nonprofit organization that focuses on improving the health and well-being of the homeless population. We do this by providing hygiene stations on the go. This way, we can encourage the homeless population to be their best selves.
So what is the problem? According to a 2017 census from the New York City Department of Homeless Services, there are more than 60,000 housing insecure individuals throughout the 5 boroughs. We have interviewed over 100 of these individuals, and many of them have told us that showering is inaccessible. This is for either geographical reasons or financial reasons, but also because they feel disrespected or unwelcome in the places they are forced into using to maintain basic standards of personal hygiene. Essentially, it is nearly impossible for them to come close to the levels of cleanliness that you and I enjoy and that we may even take for granted. By a show of hands, how many of you have showered within the last 24 hours? Some of the people we interviewed hadn't had a proper shower in months. Also, showering has been shown to prevent diseases that are prevalent among the homeless community.
So we have discovered that there is a need for a shower alternative, and there is a greater public health impact here. According to the research from International Journal of Environmental Research and Public Health, there is an increased risk of parasitic, bacterial, and fungal infection among people who are homeless. For example, scabies and aphids are very common among people who are homeless in their skin conditions. And all of this can be prevented and elevated with better personal hygiene. And increased access and utilization to sanitary facility can not only improve their health, but also increase their income and the likelihood of getting a job. There's a woman that we interviewed, and she told us that when she looked more clean, people are more likely to look her into the eyes and also provide her with the financial assistance. So all of this together can really
Sorry about that. Sorry.
All of this together can really increase their dignity and self-esteem and really make their lives better.
In New York City, there are a few services that provide showers to homeless people. These include New York City Parks and Recreation, public showers, and homeless shelters. From the 100+ interviews that we conducted, we were able to get a feel of the general attitudes of homeless people towards these services. We determined that homeless people feel both unsafe and unclean when using these services, and oftentimes lack the proper documentation in order to access them. We also found that there is a general lack of public showers throughout the island, and those that are available are far away from each other. This means that homeless people have to travel far distances in order to access showers. From our interviews, we know that homeless people do prioritize hygiene. However, for the reasons that I mentioned, they do not have access to showers. So with our idea with UVIA, rather than having our homeless people come to showers, by being mobile, we plan to bring showers and hygiene to the people.
So keeping this in mind, we came up with a solution to outfit a municipal bus with 3 separate shower stalls, each connected to a waste disposal unit under the bus. We'll be stopping at 2 locations monthly and alternating between the locations daily in order to maximize their convenience, consistency, and impact among the homeless individuals. At each of these locations, we'll be connected to nearby fire hydrants after receiving permits from the government. In terms of logistics, we'll have a scheduling service that's accessible online and in person in order to not only minimize the wait time for homeless individuals, but minimize the time away from them earning income.
Our retrofitted bus will have a driving area, a mechanical room, and 3 separate private shower stalls. It is important for us to provide personal and private shower stalls rather than having a more communal shower system like other services have, because homeless people live the majority of their lives in public spaces. Our clients will arrive at our bus station. They will sign up for an available time slot, or unless they have an appointment with us already, they will enter the bus, and after 17 minutes they will exit and be asked to fill out a voluntary survey about our services and their experience. Each stall will have 1 shower, 1 toilet, 1 sink, and 2 shelves for them to store their personal belongings.
In order to offer a more luxurious experience, we will provide high-quality, aesthetically pleasing room decor and aromas.
So overall, UVA is a shower that goes to our clients. We will provide them with a warm welcome, a clean and private shower stall, towel service, and shower products. Our value lies in the fact that we are the cleanest, safest, and most convenient hygiene service for the homeless population. We also guarantee that each person that uses our service will be provided with the utmost respect and dignity every shower they take.
Our target market will include the homeless population in both downtown and midtown Manhattan. We'll serve those who do not frequent homeless shelters, as well as offer an attractive alternative to those who do use the parks, public showers, and shelters that Lucia mentioned. This map shows the findings of a 2010 tenement census. You can see that the dark areas show where there are larger populations of homeless people. More recently, the New York City Department of Homeless Services corroborated these findings, counting these locations among the quote-unquote hotspots for homeless people. A lot of the people that we spoke to were actually around these areas and very positively responsive to our idea. So in order to maximize the number of people we can reach, UVA's bus will stop at these two locations.
So to reach our target population, we're going to design our pamphlet with schedule, time, and location and distribute to people who are homeless. We're also going to post our posters and flyers in areas where they tend to congregate. We also plan to advertise our service on the NYC linked electronic panel, which people who are homeless often use it for Wi-Fi and make calls. And based on our interviews, these are the most effective way for us to stay connected with our target population. After our launch, in order to maintain awareness, our bus design and its mobility as we navigate around New York City will really attract people's attention and curiosity. And finally, we will have our user-friendly website for the people who are homeless to go on the website to make an appointment for their shower and also for the public to donate money.
So to take advantage of all this marketing and ensure the sustainability of our business, we have 4 main streams of revenue. After talking to those 100 potential users, we found an 80% willingness to pay for our service. So the majority of our revenue will come from charging $4 for a 17-minute shower. Our next biggest stream of revenue will be in year 1, where we'll be crowdfunding to kickstart our business off the ground. Looking at projects with similar goals across different cities in the United States, we saw they were able to raise $40,000 to $60,000. For this reason, we believe that $50,000 is a reasonable goal because clearly it's a problem that people resonate with. We'll also be looking at grants and donations. So for grants, they'll be specifically targeted towards businesses that help homeless individuals. And our donation strategy is twofold. First, we'll be looking at passerbys to sponsor showers. We believe that this will be successful because people will get to see the tangible impact that their dollars are making. Second, we plan on looking at the Dwayne Reed Red Cross model, where we'll partner with franchises who have had issues in the past with homeless individuals using their bathrooms and their facilities to clean up. We'll partner with these franchises to offer their patrons the opportunity to donate $1 or $2 at the point of checkout towards our cause. Finally, we'll be selling ads on our bus in order to help businesses either associate with our brand and improve their goodwill. Looking at our operating costs, we project between utilities, supplies, waste disposal, marketing, repairs and maintenance, insurance, and payroll, that our operating costs should be around $195,000. Between our projected $220,000 in operating profits and $195,000 in operating costs, we can see a yearly operating profit of $25,000. With our vehicular acquisition and retrofitting costs being $100,000, we believe that we can use our yearly operating profits to pay down this bus over 4 years and ensure the sustainability and potentially even scalability of our business.
So our process begins by raising $100,000 that will go towards retrofitting and purchasing and retrofitting our bus. Once we have acquired our bus and we have made the necessary changes to our bus, we will then have gathered a team which will include both paid personnel and volunteers. We will have a soft launch in our downtown location so that we can gather some feedback on our bus so that we can ensure that our customers have the greatest satisfaction. We will then, once we have made the necessary adjustments to our bus, we will then have a grand opening, which will service both downtown and midtown locations.
We at UVA strive to provide our users with a warm shower and luxurious atmosphere after a long, cold night out on the streets. UVA also aspires to craft a safe environment that gives our users the respect they've long been denied and that enables them to be their best selves. Thank you.
Okay, that's good.
So, thank you all for coming. Hi, I'm Jackie.
I'm Alicia.
I'm Hannah.
I'm Bob.
My name is Eric, and we're here to present our solution to the dental health care crisis in New York City. Most Americans have really unhealthy oral habits, and they're not seeing their dentist enough. And what this causes is a rising prevalence rate of tooth decay and gum disease in New York City and across the United States. So our solution is Smart Gum, a post-meal gum that will provide more oral health benefits than any other mass sales gum on the market.
So, dental health is America's big public health problem. I've been working at multiple dental clinics over the years, and I saw many patients who just have serious level of tooth decay and who only have 1 or 2 teeth left. And this happened because they didn't see their dentist enough, and they left their teeth untreated for too long for many reasons. And what's more unfortunate is that the dentist I might work with said most of their dental cares are highly preventable.
So,
and there are preventative measures, including mouthwash, flossing, or brushing teeth after meals. But as we interviewed 102 people, we found out that most of them find these methods to be very inconvenient. And we interviewed, as you can look at the numbers on the screen, too many Americans are suffering and their overall health definitely needs some improvements.
So what is our solution? Well, we are Smart Gum. We're a delicious, on-the-go, convenient, sugar-free gum that provides preventative oral and dental health care by intervening right after meals or eating. Our value proposition to our customers is to help them feel beautiful, cleansed, but also prideful for taking care of their overall health and wellness.
So you might be curious, why gum? Actually, most of us have really bad eating habits in terms of oral health. We eat too often, too many coffee breaks, and too many snacks. And what this causes is that it makes our mouth's pH levels to drop sharply too many times during the day to the critical level. And this makes our mouth to be more vulnerable to tooth decay. As you all know, teeth never heal themselves, and that's why preventative measures is really important for adults under 65. And so we interviewed people to assess what kinds of post-meal oral hygiene product they prefer to use. So given the choice between chewing gum, brushing, mouthwash, water rinsing, and flossing, 75 out of 102 answered that they prefer chewing gum. And surprisingly, 60% already chew their gum after meals. So if people are already chewing gums and we are the healthiest gum on the market, it means we have the best chance to provide dental care in the most convenient way that does not interfere with people's current habits.
Smart Gum will provide the most desirable, accessible, and cost-effective dental care on the market because of its unique ingredients, its low cost, and the demand for gum relative to other oral health care products. Smart Gum is a sugar-free gum with xylitol, probiotics, and fluoride. Sugar is commonly found in most mass sales gums, but that actually causes tooth decay. So we replaced it with the only sugar alcohol on the market that prevents tooth decay, called xylitol. Our probiotic strand provides a wide array of oral health benefits, including protecting your mouth from bad bacteria and preventing gingivitis in your gums. Our fluoride provides protection against tartar, and it actually makes your teeth less prone to decay. In its totality, there is no other gum in the market that provides this many oral health benefits.
So, why do we consume the products that we do? We've already established that chewing gum is more desirable than using other dental health products after meals because it's convenient, it's on the go, and it balances the changes in pH that occur after eating meals, preventing a lot of cavities and other tooth decay and other dental problems. But what about other gums on the market? So according to our interviews, we found that people that regularly chew gum already consider the healthiness of gums as a primary factor in their purchasing decision of gum. So people, more and more people are starting to care about what's in the stuff that they put in their mouths. So some people are even starting to choose xylitol over other sugar alcohols that exist. And so not only are people starting to care about choosing healthier gums, they also care about what constitutes their gum. So having probiotics in our product was one of the major exciters for the people that we spoke to because of the tremendous health benefits that they provide. So because of the health benefits and overall sense of well-being that our product will provide, we will definitely have an edge over the other gums that are already in the market. And because of this understanding, we know that there will likely be a demand for our product. So according to this graph, you can see healthiness versus the price per stick of gum for various brands of gum. And you can see that most gums fall in the bottom left corner, which means that they're cheaper, but they're also not very healthy. But gums that are probiotic gums only probiotic gums are really expensive, and they're healthy, but they're not as healthy as could be. And same with fluoride gums, they're quite expensive, but and they're healthy, but not to their full potential. And you can see Smart Gum, and that's in the top left corner, and you can see it's very healthy. It's a little bit pricier than some of the mainstream gums like Trident and Orbit, but it still provides the most amount of benefit, and it's the healthiest that there is.
Our gum will be made widely accessible through our distribution model. Once we can prove that our gum sells, we can start putting it in the hands of vendors, delis, restaurants, convenience stores immediately. That means that we can make this product accessible to people across the economic spectrum in New York City. Now, as Alicia mentioned, our gum is going to be a couple bucks more expensive than Dentine Ice or the Trident White that you're going to find in the corner. But our gum provides far more benefits. It will be made just as accessible as the Trident White front. Now, in comparison to other oral health care products like mouthwash, our gum has far more demand behind it. Gum is a far more desirable product, and will be made just as accessible and be made much more affordable. Now, there's a third category of markets that we compete against called specialty gums. This includes gums with probiotics, gums with fluoride. But there is no product in the market that has both probiotics and fluoride. And our gum is more accessible and more affordable than all of those gums.
So we've been working and vetting for a couple different vendors that we found through Alibaba. One vendor that I found that is willing to produce and is able to make our unique recipe of gum gave us a quote saying that it would cost us 10 cents per piece. And we found a producer for our unique branding and manufacturing, so the boxes, and they're willing to produce that for 10 cents a box. That's, if you look on the slide, this shows us like how much it'll cost for 14 pieces of gum per pack.
So how do we plan on, so the cost per pack would be $165, and our initial plan would be to manufacture 2,000 packs of gum. And that would be a total of $3,300, which we would raise through personal investment. And with these 2,000 packs, we plan on selling them through two means of distribution, which would be through pop-up shops and Kickstarter. Why Kickstarter? We are simply following the Simply Gum model, which is this gum that came out in 2013, and it's a sugar-free gum which was advertised on Kickstarter and also sold on Kickstarter for $5 a pack of gum. So our plan is to mimic their model and sell our initial 2,000 packs for $5 off of Kickstarter as well as pop-up shops. That would leave us with $3.35 of profit per pack, with a total profit of $6,700 off the first 2,000 packs of gum. With this profit, our plan is to buy another, to manufacture another 2,000 packs of gum to see if, in fact, the reason we would do this is because the first round, the initial 2,000 packs of gum that we manufacture, we want to see if there's actually a demand for our gum. If there is a demand for our gum, we plan on taking it to vendors and distributors across New York City and try to get our gum on the market.
Okay, so for marketing, we, as all of us at Smartphone, want to make sure that we all, that everyone hears about our product and knows about our product. So we want to make sure that our consumers know that if they buy our gum, they put themselves first. So we want to make sure that people are aware of all of our benefits, and we want to make sure that they understand that this gum will be making them the best possible, healthiest, and most wholesome clean version of themselves that they can be. And so our primary marketing strategies will include in-store demos and free samples, campus representatives that can spread awareness about our product to other individuals on campus, and pop-up shops. Secondary marketing strategies will include dentists that can possibly support and promote our product, and spreading awareness through social media like Facebook, Twitter, and Instagram.
So our distribution channels, which is here, are our pathway to sustainability. That's what we are relying on. So currently we are just testing for product demand. That's our most major concern. If our product does sell, we plan on branching out to wholesalers and convenience stores across New York City, hopefully across the US. Thank you.
Hi everyone, thank you for being here. We are Survivor-Led Sexual Violence Unit, and we are a consulting company that works to prevent sexual violence on college campuses as well as in corporate and work settings in a more personalized and powerful and effective way than is currently being done. And this is our team. I'm Sanjana.
I'm Lillian. I'm Atara.
I'm Anjali.
I'm Angela. Sexual assault is more prevalent than ever. It is on our college and university campuses, it's in the work industry, and it's all over the newspaper headlines, showing us how prevalent this issue is and the greater need to solve it. And while there are efforts out there to minimize this issue, such as sexual assault education programs, based on our user interviews, we concluded that these programs are extremely ineffective and something should be done. Anjali will talk about this a little bit more later on. Upon doing our research, we came across a study focused on the analysis of the effectiveness of sexual assault programs at colleges and universities, and they concluded that the leader of the program plays a large role in how effective the program will be. It was based on this research, as well as our user interviews, that allowed us to create what we believe is the most effective sexual assault education program.
As Atara has said, as you can tell from these statistics, sexual violence is a significant public health problem that affects both female and male college students. Sexual violence can have physical, emotional, and psychological effects. These include depression, post-traumatic stress disorder, eating disorders, sleeping disorders, and substance abuse. In fact, about a third of women who report instances of sexual violence They've also reported post-traumatic stress disorder symptoms up to and including 9 months after their assault, and or have contemplated suicide at some point after their sexual assault. For NYU specifically, between the years of 2013 and 2014, as is circled in purple over there, only 44 instances of sexual violence were actually reported to the Washington Square campus, and this was based on procedures outlined by Title IX in the Clarity Act. However, this information, this data is incredibly limited because it only reflects reporting that was done through formal resources like reporting to the police, and generally speaking and in all contexts, sexual violence is notoriously unreported.
So the market we're looking at are all universities. However, we want to start here at NYU because NYU is the campus we know best. Afterwards, we plan on reaching out to other universities in New York City as well as colleges in other urban areas. And then through establishing our reputation, we hope to branch out to other universities and learning institutions across the nation. And although we plan to start with universities, we do recognize that sexual assault is a problem everywhere. And as we've seen in the news recently, it's a big problem in the workforce. So we do realize that in the future, we have the potential to reach out to corporations to implement our program there as well.
Our business model will address this extensive sexual violence problem on college campuses by making campuses safer through survivor-led preventive education and training against sexual violence, which will first be implemented during freshman undergraduates' first semester. Our model will provide students with more dynamic and engaging ways to learn and talk about sexual violence on their college campuses. And in addition, Survivor-Led will have the important benefit of empowering survivors, both students and non-students, to discuss their personal experiences with sexual violence in healthy but also controlled settings, as well as to educate their peers. This makes our business model more relatable because we are providing more in-person interactive training than the currently primarily online-based education that's in place at universities like NYU.
So as Sanjana said, we currently at NYU have an online model, but we talked to 110 people on our campus and beyond our campus as well to understand this landscape. So we spoke to 110 people that included students, both those who identified as survivors and those who didn't, residence hall assistants, program directors, faculty, etc. And we kind of picked up on two themes. And the first one was that the current model, which is called Think About It, and I'll get into that more later, doesn't work. And it's very easy to flip through the different pages in the online system. So you can put it on mute, you can go on your phone, you really don't have to pay attention. And so people said that they just weren't energized to really care about the issue. And the second thing that we picked up on, both from people who, again, identified as survivors as well as those who did not, both said that it would be empowering and engaging for survivors to be leading this mission and this educational program. And they said that as long as it was done in a tactful way, it would be much more personalized and would actually make them want to care about the issue and pay attention. So just to contextualize this is the current model. I don't know if anyone remembers taking it. Most people that we spoke to who even vaguely remembered taking the training barely remembered the content of it or said that it wasn't effective. As you can see, it is pretty frivolous. It's just very inappropriate. And so we kind of wanted to look into what other programs exist. There are online programs, as mentioned. Think About It uses, or NYU uses Think About It. There are also workshops and mixed methods, as well as performance-based programs. And so where we take it a step further is that we combine all three of those, and we also make sure that survivors are at the front of that, because no one knows better about this issue than people who have experienced it themselves, and will do it in a way that actually does justice to the trauma that sexual violence survivors experience, as Sanjana mentioned.
So what is our product? We have three different options right here. Three different options to reach out to the entire population of diverse student bodies in all degree-granting institutions. So the first one is dorm-based. In dorms, we'll have, with the help of the RAs and survivors, we'll have 1 week dedicated to educating the students on the life sexual assault issues on campus. And this will be required for them to dorm on campus. Second one is curriculum-based. What's great about curriculum-based is we're implementing our program on top of what already exists. For example, at NYU, we have the Writing the Essay course. 1 week will be dedicated to researching and writing about sexual assault issues that are on campus. And we'll also have the survivors talk to them about their experiences. Lastly, we'll have the first year core seminars to implement our program. Similar to the curriculum base, we'll also have 1 week dedicated to talking about sexual assault, but this one will have discussions with the survivors.
Based on the interviews and research that we conducted, we came up with 3 main components. So as I said, based on our interviews and research that Anjali talked about earlier, we have 3 main components to our company. The first is that, as we mentioned, is that it's survivor-led. This way we can provide students with more engaging way to learn about sexual harassment on campus. And our job will be going into these universities and working with the administration as well as current organizations already in place dealing with sexual harassment to find survivors on these campuses that are willing to lead these classes. Second of all, it will be in person with small class sizes. Online training may seem more cost effective. However, we found a study that showed that in-person and longer training sessions were way more effective than online training sessions. Furthermore, the study also found that having people participating in the class interacting with each other was more effective than the straight lecture. Therefore, our program will not only be in person, but we'll have small class sizes in order to facilitate more class discussion and interaction. Finally, because we're working with different universities, we hope to tailor our program to these different universities. For example, NYU is urban, it's got a large campus, a lot of computers, and their program needs to be different from a school in a rural environment with a smaller student body and a lot of people living on campus.
So the customers of our business are the universities, and the appeal for a university to drop their current sexual assault education program and implement ours is firstly because their current program is ineffective. Therefore, any cost they're putting towards this program is essentially a waste of money. Secondly, universities want to maintain and increase their customer segment, who are the parents paying for their children to attend these schools, and parents want their children to attend safe schools. A university using our program can offer students a safe campus and environment to learn in. And lastly, for PR purposes, which is where our business will achieve its sustainability, universities will continue to come back to us year after year because they want to be seen as a school who offers an empirical and evidence-based sexual assault education program such as ours.
Here are the cost and revenue streams. Please pay attention to the direction of the arrows. If you see on the very right, the degree granting institution will be our major source of revenue. They will be paying our costs based on the tier pricing model, which ranges from $20,000 to $100,000 per year. So for example, large state universities that have a lot of funding from the government and have more students will be paying us $100,000, up to $100,000. But smaller institutes and colleges will be paying about $20,000 to $50,000. Here are our costs. Our major costs will come from funding the survivor educators. So they will be paid $15 per hour, which amounts to about $375 per semester. And our other source of cost will come from designing the curriculum. We are thinking about starting off at $50,000 per year, which will definitely go up as more schools enroll into our program. As the revenues go up, costs will also go up.
So thank you so much for being here. Once again, we're a consulting service that works to prevent sexual violence in college campuses as well as in work settings, and we look forward to hearing your thoughts and questions.
Okay, last group.
Hi, I'm Rachel. I'm studying computer science at NYU, and when I'm up late coding and I don't really have time for a full meal, I usually just drink a cup of coffee and watch that as dinner.
Hi, I'm Sally. I'm an athlete, and I'm often rushing from the gym to meetings to classes, and I find that I don't have enough time to go to a restaurant, sit down, and order food. So I often rely on a cafe or granola bar to get me through the day until I haven't got time.
Hi, I'm Nicole, and as someone involved in student government here at NYU and with a heavy course load, I don't have a lot of time to go grocery shopping or cook meals for myself, so I'm often relying on vending machine snacks in the library.
Hi, I'm Kyle. I'm a commuter student at NYU. I'm often on the trains all the time, or most of the time, and don't really have time for a proper meal throughout the day, so I sometimes turn to things like a candy bar or a granola bar.
Hi, I'm Ashley. I'm a nutrition major here at NYU,
And my program often has night classes, so I will usually bring a naked green juice with me to class because it's quick and cheap, but it has like 50 grams of sugar in just one bottle. So as you can see with my teammates and I, there is a sacrifice of eating healthy in college due to time, a lack of time and money. And this sacrifice does not only exist between the 5 of us, but the consequences of it can be seen nationwide. For instance, 1 in 5 college students is either overweight or obese. In addition, 20% of college students eat 3 or more high-fat foods per day. In addition, only 6.9 young adults get their recommended daily vegetable intake, and only 1 in 10 young adults meet their recommended daily fruit intake. Therefore, across the United States, on average, young adults are eating a diet high in calorically dense foods, like fast foods and highly processed foods, but low in nutrient-dense foods like fruits and vegetables. This type of diet can have both short-term and long-term consequences. In the short term, it can hurt academic performance and also overall health, and in the long term, it can lead to the development of chronic diseases like cancer, heart disease, and diabetes.
So what is our solution? A solution we created was a delicious drink where users can prepare a meal on the go to save money, make time, and meet nutritional needs. So you would save money because the average cost of a bottle would be less than the average cost of a meal, and you would make time because there's no need to go grocery shopping or prepare your meals. And you save money and time by meeting your nutritional needs.
So what's in a bottle of something? Well, it will have all of your macronutrient requirements for one meal, in addition to 20 to 25% of your micronutrient requirements for a day, including antioxidants for immune support. It will also have 8 grams of fiber, which is more than the leading meal replacements, and it will include probiotics and prebiotics to support a healthy gut flora. In addition, it will only have 1 gram of sugar, which is much, much less than other brands of meal replacements. Overall, it will contain 400 calories, which is what should be met in a standard meal. It will be flavored with natural flavors. It will be completely plant-based, so it's vegan and vegetarian friendly. It will be allergen-free, so those with the top 8 allergens need not to worry when consuming our product. And finally, it will be made with real fruits, veggies, and greens.
So what does the market look like in which we are working in? We acknowledge that there are many other competitors out there in the market, and compared to some of these competitors, our company put taste as a priority. We wanted to make a delicious drink that is both affordable, pre-made, shelf-stable, and nutritious. And while some of these other competitors target specific niches in the population, our company is going to start by targeting a diversity of demographics within the population of college students.
So
How does it all work? We initially want to hand out samples on college campuses, and after that, students or customers can order batches of 10 bottles to get delivered to their door, and after that, all you have to do is enjoy our delicious drink.
So who are the stakeholders in our business model? That includes our company, Sante, our customers who we are initially targeting towards college students and young adults, and partnerships, which are also going to be very important for our business because we need to actually distribute this product to our customers. So that's going to require partnerships with shipping companies like UPS, FedEx, things like that. And we also have to do, we have to establish partnerships with universities in order to actually get the word out over our drink, Sante, and to raise the hype for it and to also decrease the skepticism of a meal replacement drink.
So how are we going to maximize our outreach to our target population and overcome the skepticism that our competitors face? First, we are creating a aesthetically pleasing packaging with a simple design that will attract students. We're also going to maximize our social media presence and hand out samples, as I said earlier, through campus reps who are our students' peers and people whom they can trust. And we hope that once they try our samples, they'll see how delicious our flavor is, and that'll allow them to order them online and keep them in our customer segment. Another way that we will retain our customers is through the charitable component of our business. A portion of our proceeds will go to Feeding America, and in our 100+ interviews with college students, we found that a lot of people want to donate to charity, though they can't do so out of pocket, and this will give them a means to do so.
We'll also have a point reward system in which students and customers can rack up discounts to local businesses that promote healthy lifestyles like the one our business promotes. We'll also give discounts on future purchases for those who recycle their products and send them back to us.
So how are we going to reach our market size? Well, we did over 100 interviews, as Nicole mentioned, and Chris mentioned, and we found that most people would be willing to drink our product on a daily or bi-weekly basis. We reached out to our friends of friends, and third parties, and just were interested in finding out who would drink the product. So we think that we could reasonably market to all of NYU in people who have busy and budgeted lifestyles. But we do hope to expand our company upon validation in this NYU market to or other urban colleges in cities such as Houston and Chicago and in Los Angeles.
So as Rachel mentioned earlier, we did perform upwards of 120 interviews with college students of various demographics and backgrounds, ranging from coders, commuters, freshman students that have dining hall plans, athletes, all sorts of backgrounds. So we found that through our interviews, approximately 82% said that they would be excited to actually try a product like Santé, which is delicious, affordable, and nutritious, but also very convenient. Through our interviews, we also found that the majority of people would use Santé as a supplement to their pre-existing diet in order to gain proper nutrition in the absence of a proper meal. We also found that other students would use it as a source of energy, a substitute for putting in the effort and time to making a meal for yourself. And there was also a portion of students who would actually use this as a full meal replacement.
So cost, how much is it going to cost? We know that we want to make more than we spend, and we found a third party that is willing to produce our product and has the industry and ability to do that in a much easier capacity. We also want to factor in partnerships with delivery companies such as FedEx and UPS in order to streamline the process, but we know that we're going to have marketing and legal fees that need to be factored into each 10 bottle box. So we made our own manufactured our own bottle, and it cost us $10, but we're confident that we can get that bottle down as we develop as a company over time, and we're going to start by manufacturing 10,000 bottles, rather than 100, and 1,000 bottles, and we are going to start with that. Funding propositions, we're asking for $10,000. We are going to use a combination of crowdfunding websites and investor websites. So the crowdfunding websites we're interested in reaching out to are Indiegogo and Kickstarter, and we've seen other similar products, drinkable, digestible products that you can't do over the internet, do well on these types of websites, raising up to $400,000 in income. In addition, we will sell swag, t-shirts, hats, and perhaps even potential discounts on the boxes through these websites. We also plan on reaching out to companies, to websites such as AngelList in order to find investors who are interested in student-oriented and nutrition-oriented products.
So looking forward to our projections for the first year, we want to first, of course, determine the final formula of our product, what it's going to taste like, what it's going to include, and we also have to make sure that it's shelf stable and that it contains all the important ingredients and nutrients that we want in order to combat this public health problem of college students not meeting their nutrition requirements. So that is an important goal that we have before us, and we also need to determine the cost structure more in detail. Looking forward, though, we want to distribute samples, as my colleagues mentioned earlier, to our target population on university settings. So that would basically help gain customer trust and also decrease existing stigma that we found through interviews against meal replacement beverages in terms of actually drinking something versus actually eating a meal. So the sample distribution will be very important. In terms of launching, we will focus at first on these boxed sales of Santé with 10 bottle boxes, and we would have our customers buy the beverage in bulk, well, in a box of 10 bottles. But looking forward into the future, we hope to make this a scalable business model by expanding to on-campus merchants for individual sale and for augmenting our sales in general. And we also want to develop new flavors and keep things fresh and exciting and desirable for our customers. So in conclusion, what we have for you today is a proposed delicious, nutritious, and convenient option for college students and young adults alike, or anyone who is cut for time, that has a budget, that needs to fulfill their nutrition requirements. And we actually have a preliminary sample of our proposed beverage for you to try today. So thank you.
Thank you to all the teams. Those were fantastic. One thing I'd like to do before we go too much farther is to mention that each of the teams has had a mentor who generously volunteered their time. The mentor for the team that just presented is the incomparable Anne Budlong, who's here with us today. Andy Moss is also one of our mentors.